We'll take a picture of that for your collection.
An incoming call you have. Answer it quickly, you should.
Hello? Hello? Everything's all right? How much has it grown?
Doubled size.
Did you get a picture? Oh, good. So everything's all right.
I'll call you later on. Okay, I love you. Bye.
Yes, everything's all right.
Another week of progress. Shocking.
Well, it's excellent news.
Rachel's consultant is Raj Rai. In her last 2 failed pregnancies, he prescribed drugs to help the embryos implant. This time, he is controversially adding another drug, a steroid, to her treatment.
Okay.
Now, how are you coping with the steroids?
Okay.
He believes that Rachel's immune system may be attacking the placenta and that steroids could prevent it.
The way in which steroids may do this is by altering the levels of certain chemical messengers within the lining of the womb.
The benefit of steroids in treating miscarriage has not yet been proven, and there may be significant side effects.
Well, always when a new treatment is suggested, the first steps, clinically, are to try it, to pilot it on 1 or 2 patients.
We're very aware that we are just research now, that there isn't any proven facts that steroids work, but it's a chance that maybe it does. Maybe it might not work for somebody, but it might work for us.
Then next we must run the trial that will be able to demonstrate whether it significantly improves outcome. But whether Rachel's pregnancy is successful or not is not going to answer that question. She's just a pilot patient that is ongoing at the moment.
Excellent. Okay, I'll see you next week then.
When the clinic's patients embark on their next pregnancies, they are offered weekly scans to monitor their baby's development. While these scans usually offer reassurance, they are also a time of great anxiety. Marisa Palmer is 8 weeks pregnant. She's been through this many times before.
Every time I was getting pregnant, everybody was celebrating and the miscarriage. 1 time, 2 times, 3 times, 4, and from the 5th, I stopped telling the people that I was pregnant. Can you please tell me what you're saying?
Yes, I will. Don't worry.
Marisa, I'm really, really sorry. I can't see a heartbeat there today. I was heartbeat 2 days ago. And I'm so sorry.
Marisa's tiny embryo has died since her last scan.
Because of so many miscarriages, I thought that this time would be easier. You think you're strong enough this time, and no, it's get weaker.
When a patient miscarries, Leslie Regan believes it's important to try to analyse cells from the embryo as quickly as possible.
The vast majority of all miscarriages are random or bad luck events caused by genetic or chromosomal abnormalities in the embryo. And that's one of the reasons why we're so keen to get hold of the tissues, if we possibly can, and to see whether we can analyse them genetically.
The search for the telltale signs of a chromosomal abnormality starts with an operation to remove the remains of the pregnancy. Studying the chromosomes can only provide an answer for this one miscarriage. What it cannot do is explain Marisa's previous losses. It is only by analysing the patient's blood that a persistent problem may be identified. Joanne Brown is on her way back to St Mary's. She hopes that her blood tests will finally reveal the reason for her 5 miscarriages.
She's very nervous, I know she is, apprehensive. I think the best outcome, in a strange sort of way, is that there's nothing wrong with her. But if there's nothing wrong with her, then we've got a decision to make as to really whether we try again and put ourselves through it again. We are conscious that our life goes on hold when we try, and we're very conscious of not perhaps giving Olivia quality time because we're too wrapped up in other things.
I feel a big guilt, do feel guilt about that. A lot of guilt that I've missed out on, especially earlier years, that I've probably missed out on a lot because I've not been well. I feel guilty.
Her face kind of drops and her voice kind of loses it just kind of goes a bit flat, and you can see in her eyes that she's not very happy. We get her some tissues first, and then we kind of sit and tell her that it's not her fault, because sometimes she thinks it's her fault.
In just a few hours, Joanne will get the results of her tests. Rachel and Gary are reaching the time when most of their previous pregnancies failed. Rachel has never gone beyond 11 weeks. She is now 9 weeks pregnant.
So we're trying to identify the factors that can disrupt the progress of the pregnancy, and we realise sometimes about 8 to 9 weeks the heartbeat will stop because something was attacking the placenta, the baby's lifeline.
Right, baby looks fine, okay? Just get bigger to show you.
Although the baby has a strong heartbeat, it hasn't grown as much as Rachel was expecting.
Each week it's doubled, and this week it's only grown 5 millimetres. But it's always been the sign of when something's wrong, is when the growth started to slow down.
With so much uncertainty for the couple, the stress of waiting is taking its toll.
One of the things you said was, I've got no feelings and I don't care how you feel. And that's not the case. That hurt. I'm in a catch-22 situation. I can't be with her because I upset her. I can't be away from her because I upset her. And I don't want to be with her all the time.
I feel that I'm going through it and doing it alone.
Yeah.
Because we're not talking about it and we're not saying how we feel. It's not been a problem in the past for us to talk, has it really? We've always been quite open and said how we feel. I don't know why.
This time's very different.
I think because we are progressing further, and it's just the fear factor is just higher than ever.
I've had the next two still. Next two start now.
3 weeks have passed since Marisa's latest pregnancy ended. Cells from her fetus have been growing in a North London laboratory. Genetic scientist Richard Ellis is checking if the fetus had any missing or extra chromosomes that could have caused the miscarriage.
The chromosomes contain the genes, which is really the blueprint of how your body's made. So I'm looking at a single nucleus now from Marisa's fetus. And usually a normal individual would have 46 chromosomes. And counting the chromosomes, there are 47 chromosomes. And I can see that the extra chromosome is an extra chromosome 16. This is never seen in live-born individuals. So fetuses that have 3 copies of chromosome 16 would always miscarry very early in the pregnancy.
Hello, Marisa. How are you? You recovering?
Yes.
Leslie Regan can now let Marisa know why her last pregnancy miscarried.
After the age of 35, the incidence of chromosomal abnormalities increases, and that's because of the age of the woman's eggs. So women, rather sadly, I think, are born with all of the eggs that they're ever going to have, and we believe that that leads to the increase in chromosomal abnormalities in pregnancies in women over the age of 35. So I know that doesn't give you back the pregnancy that you wanted to be successful, but I think what it does do is provide us with a very black and white reason for why you lost the pregnancy.
One-off chromosome abnormalities in the fetus account for about half of all early losses, and most women at the clinic are likely to have suffered some so-called bad luck miscarriages. But what patients like Joanne want to hear is that they haven't just been unlucky, but that they also have one of the rarer underlying causes of miscarriage that can be treated.
Most couples come along to the miscarriage clinic thinking that someone is going to wave a magic wand and make it all right, and I just wish that could be the case. They've already been looked at very carefully by lots of other doctors and clinicians, and it's very difficult to, if you like, give them a black and white answer and a cure to go with that diagnosis, and then everything to go smoothly again.
What we need to do now, I think, is to talk through the investigations that you had done last time. So the chromosomes that both you and your husband had done are normal. Okay. The hormone tests that you had done, these were normal. Right. Turning now to all of the clotting tests that we did for you, these were normal. Okay. And we've then looked at some insulin resistance studies. Yes. But again, yours are normal. Full house of normal tests. Okay. So what I think we need to do is to go back to the problems getting pregnant.
Okay. It's a challenge persuading couples that, in fact, if they go through this quite detailed investigative checklist and it's all normal, that they are actually much better off than if we find something. Most causes of miscarriage, actually you're better off not having them. You're better off having got to the clinic because bad luck has struck several times in a row.
With a clean bill of health from the clinic, Joanne and Dave now face the decision whether or not to embark on another pregnancy.
There is an argument to say, why do we keep putting ourselves through it? But
I don't think I can even describe it. It's just this longing and just to hold you, you know, you're a baby. I sometimes feel selfish that I can't accept that we've got one child, because some people can't even have that, and we are very, very lucky that we have got Olivia, but it doesn't make these other longings go away.
And when Mum sees another baby, then she goes all weird and she goes, "Oh, look at the little baby," and she talks to it like it's a dog. But I think it's important because they just want someone to hold and someone